When the Public Health Ministry announced that from October 1st, COVID-19 would be reclassified as a monitored communicable disease, it also changed how infected people will be treated. According to the Medical Services Department, COVID-19 patients who are asymptomatic or show mild symptoms no longer have to isolate. Instead, they can live their lives normally, but they must strictly comply with self-protection measures for 5 days, which are distancing, mask wearing, hand washing, and testing. COVID-19 patients with severe symptoms, including those who require ventilators, can still use their USIP Plus rights to get treatment at any hospital within 72 hours. USIP Plus, or the Universal Coverage for Emergency Patients, is a type of insurance that allows patients who are critically ill to receive medical treatment at their nearest hospital without charge. Those with moderate symptoms, including the elderly and people with underlying non-communicable diseases, can still receive treatment in hospitals as usual based on their Social Security benefit entitlements. As for the prescribing of antiviral medication, such as favipiravir or molnupiravir, the Public Health Ministry has confirmed that there are sufficient supplies of both. However, such medications are currently not available over the counter without a doctor's prescription. This is because they are registered only for emergency use. Doctors will decide whether to prescribe these antiviral drugs based on the symptoms presenting. If the symptoms are not severe, it is likely that doctors will prescribe favipiravir or the fatalizone herbal medicine. But if there are underlying risks, doctors may prescribe Paxlovid instead. For children under 12 years old, doctors may prescribe favipiravir tablets for 5 days if their symptoms are not severe and if they do not have pneumonia. If their symptoms get severe or if they have any underlying risks, doctors may prescribe remdesivir for 5 to 10 days. Whatever the guidelines may be, the best thing to do is to not get infected.
มีการยกเลิกการแสดงเอกสารที่เกี่ยวข้องกับเอกสารวัคซีนหรือผลการตรวจ ATK.
In fact, Public Health Minister Anutin Chanvirakul still recommends that people wear face masks when venturing outside, particularly when going to crowded areas or places with limited air circulation. As to what you should do if you do get infected with COVID-19 after October 1st, there are a few more clarifications from the Medical Services Department, including how often you should be tested with rapid antigen tests. Dr. Thongchai Kiriti Hattayakon, the acting director of the Medical Services Department, explained on Wednesday that you don't need to test yourself with rapid antigen tests every single day. However, you should test yourself if you develop symptoms such as a cough, sore throat, a runny nose, or a fever. Even if your test result is positive, you may not need antiviral drugs if your symptoms are mild, and you will be prescribed medication based on your symptoms. Even though those with mild symptoms no longer need to isolate and only need to comply strictly with the self-protection measures, Dr. Thongchai still recommends that they isolate themselves for 5 days to avoid spreading the disease to others. If you still have to go to work, Dr. Thongchai advised that you should wear double-layered face masks, wash your hands frequently, and maintain a distance from other people. If you experience continuous coughing or a severe runny nose, then you should take sick leave and avoid travel for 5 days. If symptoms become severe, such as a fever of more than 39 degrees Celsius, a blood oxygen level lower than 94%, exacerbation of any underlying disease, children experiencing loss of appetite or dehydration due to diarrhea or a high fever, you should see the doctor immediately.